Okay, so we are back live. This is Senate Health and Welfare, and we're looking at the section of S56 related to the non-citizen coverage for childcare. And
Right.
Cheryl, suggestion was made that you have a lot of experience in this area. And if you could help us a little bit understand that section of the bill and what your thoughts are about improving it or not.
Okay, great. Well, first, Madam Chair and members of the committee, thank you so much for inviting me to talk with you. I'm Cheryl Mitchell. I live in New Haven, Vermont. Our family has been farming for 50 years in the Champlain Valley. And I've been acting in human services and health and education for most of that time. So I want to commend you for Act 56. I think with some tweaks, it could be a really, really important piece of legislation for kids, for families, for communities, and for the economy of our state. So it's great. You probably know that there are about 2,600 non-citizen children in Vermont right now. The number of non-citizen families contributing to our economy, this is not just migrant families on the dairy farms, but all non-citizen families, I believe is about 4.4% of the population. So they contribute in all sectors of the economy. Most of those kids and most of those parents are here with documentation. The challenge that I think S56 is trying to address is that some of those families, especially those who are working on the dairy farms in Vermont, do not have documentation because of the way the laws are set up right now. One of the ironies is that our family raised sheep for 50 years. I would have legally been allowed to hire migrant families to work on the sheep farm. But my neighbors who are the dairy farmers that keep the Vermont economy going are not legally able to have visas to work here. So the challenge for these families, especially the ones with young kids, is that once they get to be school age, all those kids are welcome in the public schools. And in the early years, all of those children are allowed to attend Head Start programs, because the federal funding sources for public education and Head Start are not considered public benefit, quote, public benefits. But the money that flows through what you're considering the Child Care Financial Assistance Program is considered a public benefit in the eyes of the federal government, and therefore it's subject to a number of eligibility requirements, one of which is an income test. And another is that families who are applying usually need to provide their social security number. Families who are here without don't have social security numbers. Many of them are, in fact, paying taxes in Vermont. They have filed for what's called an ITIN, an individual taxpayer identification number, but it's not the same as social security. I think that there are not a lot of young children who are sort of in this limbo, or families in this limbo, but there are definitely some. And if you will indulge me for a moment, I'll tell you the story of a friend. So I started delivering food through the Foodist Pharmacy program to a pregnant woman about almost 3 years ago. Got to know her very well. She lives on a farm here in the county. She and the baby's father take turns working in the barn. They don't have documentation. Their baby actually, when she was born, was considered an American and Vermont citizen. There are quite a few young families in that kind of situation. So parents don't have documentation papers. Children are documented and as citizens. Parents are pretty terrified because we still haven't fixed this problem for people working in the dairy industry, that ICE could come at any moment and take the parents away and leave the children behind. So many of those parents are very hesitant even to access the kinds of socialization and child development that is available in our communities, because they don't feel that it has the safety of a Head Start program or a public school, even though we think that our amazing childcare programs and our family childcare homes would be excellent settings for kids who need to learn to speak English, which might not be happening at home, need to learn to get along with other children, which might not be happening if they're isolated on the farms. And that's why I think that this would be a great addition to the bill that you're looking at. I think you could probably fix this situation by directing the Department of Children and Families Child Care Development Division to change the language and policies in the eligibility processes for applying for the Child Care and Family Assistance Program, to simply say that categorically children are eligible if they or their parents lack documentation. I think that would be possible. You'd need to, I didn't have time to check with a lawyer to make sure about that. But if not, I think doing a very small program to support these families who would then feel much safer in getting the kinds of early learning experiences that their children need would be much like what Vermont did when we did the carve out so that families on TANF who were pursuing higher education could do that. So I'm happy to answer questions. I'd be happy to send you some of the background information. I know that your time is so limited. I would love to speak to you for hours about the importance of what you're doing. But if you have questions about this specific thing, please ask.
Cheryl, thank you so much. If you have some written testimony, because you did have some data that would be informative, please send it on to Alex and we'll post it on our webpage. That'd be great. And
I will do that. What I'll be
good. And now I'm going to turn to the committee members. We did introduce ourselves earlier. I think you know both Senator Hardy and myself. And sitting with us are Senator Weeks from Rutland and Senator Williams from Rutland, and Senator Gulick is on screen with you right there. So we're
great.
all
You're all here.
Yeah.
Well, I'm so pleased to meet you. I'm sorry it's on this tiny little telephone and not in person with you, but I'm so grateful that you're working on this issue. It will make a huge difference for children, and we know it's like a huge difference for our economy as well.
Thank you. Questions, committee?
Senator
Weeks.
Thank you. Thank you, Cheryl. So a good testimony. You said that there's roughly 26,000, 2,600 non-citizen family children in the state.
Yes.
You weren't aware of how many didn't have I-10 coverage to I-10, the kind of the counterparts of.
Oh, here's my clarification is that of those 2,600 kids, many of them have documented status because their parents are here on, say, refugee resettlement programs.
Right.
Perhaps moved from Canada. They're just children who are not U.S. citizens. So their parents might be from another country, might be living here as, but for the ITIN option, which is what many of the dairy workers have been involved in the state. I don't know that number, but I think I could probably get it for you.
Well, I'm just curious if you have a rough number, at least something you get a sense of it.
Sure. They're close to 1,000 undocumented dairy workers, and some of whom have young children. And I don't know that number, again, because until the kids are school age and their families feel safe having them go to school, it's not necessarily clear. We would know in Addison County because of the Open Door Clinic, which provides most of the healthcare services to the migrant population. And so we know most of the families, but many of the families are in Franklin County or the Northeast Kingdom, where their status is basically kept invisible because the parents are so frightened. But I'll try to get those numbers for you.
No, that's close enough. I just wanted to get a sense of what the subsection was.
Any other questions? Oh, we can't thank you enough for making yourself available. And thanks
Okay.
for all your good work. It keeps going on and we're very appreciative.
Well, we're appreciative of what you're doing, and I'm sure as we work these things out, we'll come to something great. So thanks for having me.
And soon we'll hear some music coming from your house, I think, too.
Yes. Okay.
Okay, thank you.
Cheryl.
Take
Bye.
care.
Thank you all.
All right. Okay, so that helps, I think. The language, she did make a suggestion about language to identify these folks as those who lack documentation, and that's a question we'll have to ask Katie Rouse how to, what the language should look like, unless there's a real pushback from our committee here, not including it. So right now,
The language that's in the bill is really what's been vetted from our previous work with the Dr. Dinosaur
Right.
program. I think what she suggested about having a language in the CCPAP program is not an option because it's a federal benefit
Right.
program. So that's why we have to create this sort of standalone, side-by-side program that has special protections for maintaining confidentiality. And you probably have maybe talked to Diva about it, because that's the program that we did a couple of years ago. And Jen Carby worked out a lot of the language, so I think he used that language.
right, this is consistent with what we've done in the past, and I think
Yes,
probably keep what we have, and,
right.
yeah.
Just add to that. So we have reached out to Diva at the committee's request. The language for Dr. Dinosaur has different federal regulations than CCPAP, so we are working to see, what additional questions. Reaching out to them, creating more questions to ask, which is good, right? We want to make sure that this makes the most sense and has the most protections, but that's where we are right now, trying to figure out what other questions we need to ask our federal partners.
And we got any recommendations that you've had?
Of course, yep.
Yeah.
I mean, we're relying on our responses from the
Yeah.
federal government.
Okay. All right, that's good. I'm just gonna,
Be careful what you ask for them.
Yes, of course,
You
yeah.
ask questions that you don't.
We're very aware, yep.
yeah. All right. Is Jen on the way?
She is in the Zoom room.
Oh, that's right.
Hi, I'm here, but I can't seem to make my video work.
Oh, maybe Alex, is there a way that you could make her?
I think it's on my end.
Your camera is on. Do you happen to have one of those little
Oh, you
protectors?
No, that's the weird part.
Yeah.
Nothing.
You sure you're not blocking it on both sides? I've done that.
No, I don't think so. I can.
Well, we'll just have to hear from you.
Okay. Sorry about that. I'm not sure. Maybe I'll send a quick e-help.
I think there was one clarification that's been added into the bill since we looked at it yesterday. Was there more? That you had brought us. There are findings, changes. Why don't you take us through?
Right. I'm going to see. Can you see my screen?
Yes,
Yes.
we can. We can't see you, but we can see your screen.
Okay. That'll work. All right. So Jennifer Carby, Legislative Counsel. So I have put up a strike all amendment, although there are not that many changes, but this is S18, and it just seemed easier to do it as a strike all than to try to show you where the various amendments would fit in. So the first thing I did was to I updated a finding and I added a finding. So the updated finding is with some more recent data on costs in projected costs in Vermont related to tobacco use. So increasing the amount we spend. I think the actual number that we were given was 404 million. So I just said more than 400 million that Vermont spends annually to treat tobacco caused illnesses, including more than $90 million each year in Medicaid expenses. This translates into a tax burden each year of over $1,000 per Vermont household. And then smoking related productivity losses add another $576 million in additional costs each
Much
year.
higher, wow.
It is much higher. These are the statistics from the, I think it was the Tobacco Free Kids. And some of them seemed a little weird to put in as very specific annual amounts, since the annual amounts keep changing. So that's why I went with some of these sort of rounder numbers in the findings. But those are what I understand to be the updated numbers. I did not make any changes to the usage. As you know, the Vermont Youth Risk Behavior Survey results are not in yet, or not available yet, from 2021. So there's nothing to update there. But I did add a finding. You can decide whether you want to put it in or not, but just saying that reflecting the FDA's action in 2020, that they took action on flavored e-cigarettes, but they only addressed flavored pod-based e-cigarettes, leaving open tank cigarettes, the e-liquids used to fill them, and flavored disposable cigarettes available for sale.
Okay.
So this next change is one that we had not specifically talked about. It's sort of more of a conceptual change, but the idea here is to try to decouple the language in our tobacco product statutes, where there's some sort of open-ended language, trying to take cannabis regulation out of the tobacco statutes to the extent they might get swept in, and reserve those for regulation through the cannabis statutes. So currently in our definition of tobacco substitute, even before the changes we're making now, there is language about this being a device that is designed to deliver nicotine or other substances into the body, and that's pretty broad. So which is how we keep inadvertently sweeping in cannabis products in one way or another. So this would decouple those. This would say, as you add language saying, as used in what we would now call subdivision A, other substances does not include cannabis and cannabis products that are offered by a cannabis establishment licensed under those cannabis establishment licensing statutes, or by a medical cannabis dispensary licensed under those statutes. So when we're regulating tobacco substitutes, e-cigarettes, we're not talking about what somebody is doing with cannabis products if they're being offered through the legal route, through the licensed establishment or licensed dispensary.
So this is referencing current statute for cannabis regulation.
Right.
Yeah, okay.
And then the same thing here for e-liquids, when we're talking about kind of any solution, substance, or other material used with a tobacco substitute. And both of these come in later in various provisions, but including the new flavor ban, to say we're not talking about cannabis and cannabis products here that are offered legally. There is already a provision in the cannabis establishment statutes that prohibits the sale of flavored cannabis products. There is not a prohibition on sale of flavored cannabis products through a medical dispensary. But again, we would just be leaving the decision-making around what should be available in the cannabis market to the cannabis statutes, and not sweeping it in with your regulation of tobacco statutes, tobacco products.
Jen, just hold on a second. So I'm always kind of trying to think of next order effects on a bill like this, or any aspect of life. But when they start mixing cannabis with tobacco and they start flavoring it, I mean, I'm always looking for like the next reaction to. So you just kind of deleted the whole impact of cannabis. That cannabis is not. This is not about cannabis. But if they start mixing, I can see that as a highly potential next step in the industry. They'll look for a.
Well, right, I mean, the one I think value that we have related to that is the federal government doesn't allow for cannabis use. And so we probably won't see our national companies mixing tobacco and cannabis. And in this state, cannabis is highly regulated by the Cannabis Control Board and by statute. So what you're bringing up might be a creative something, but Jen, can you respond?
I mean, I think all we're doing is saying when we're doing regulation here in this chapter on tobacco products, when we are using the terms tobacco substitute or defining tobacco substitute to refer to something that would deliver other substances into the body, we don't mean products that are regulated under the cannabis statutes. So even if there was a mixture of those, if they're regulated under the cannabis statutes, we're letting the cannabis statutes address those. And the same thing for e-liquids. When we are saying e-liquid in the tobacco statutes, we don't mean products that are part of the regulated cannabis market. So if there are a mix of cannabis and tobacco, I think the legislature may have to decide whether you want to regulate those as cannabis products, tobacco products, or a third category. But to the extent that that they're products that are being offered by a licensed cannabis establishment or dispensary, they're outside of the scope of this chapter.
Okay,
Yes.
okay, all right, good, yeah, I don't want to get too complicated.
Can I ask just a general question? Hey, Jen.
Yep.
Oh, wait, do you still have more to go through? I was gonna ask this when you were done. I'm sorry.
Yes.
Okay, sorry, I'll wait.
Okay. All right, so now we scroll down a little further until we get to just the typo fix that I flagged yesterday, which is just this, I think, this erroneous language in the existing statute for the title of this chapter. So that would now include misrepresenting age for purchasing tobacco products. And then finally, we get to some new language that I added here in the, so this is our new language, new section on flavored tobacco products, flavored tobacco substitutes, and flavored e-liquids being prohibited from sale. And so in our definition of characterizing flavor, I added what we were talking about yesterday, this concept, I'm calling it an induced sensation, so something that wouldn't otherwise occur, but so I said that the term characterizing flavor also includes induced sensations such as those produced by synthetic cooling agents, regardless of whether the agent itself imparts any taste or aroma.
That's the WC3 thing.
That's the WS3 thing.
What page is she on?
What
Oh,
page-
I'm sorry. I am on page 16.
There's a new
There's more
draft.
one on.
There is?
Yeah,
Yeah, she's
With the
going to the new
highlights.
draft on our webpage.
it's 1.1.
Jen, I like the induced sensations.
Thanks. There may be room for improvement on that term, but it seemed like a place to start.
It's great.
It's fine. I don't know what else to call it.
Exactly. And we had also talked some yesterday about putting in language about additives that increase nicotine absorption, but we were getting down a fairly scientific path that I was not prepared to go down. And it seemed to be getting away from the flavor idea. So we may, if that's something the committee is interested in pursuing, we can certainly look at that. But for purposes of moving you forward with this bill at this time, I did not include anything else in here because it just wasn't clear to me how it would fit.
I think that's probably the good decision, not to do it. Yeah. Scary little thought, but.
I have a sense that this bill will have to be amended, just given that the tobacco companies are so good at pivoting and, creating technical fixes to problems that they come up with against.
Yeah, you're right. Every time we close one door, another one opens. Loophole here, loophole there. Is that it, Jen, for the?
That is it. Yes. Sorry, I had started scrolling ahead to make sure that that was it.
Yeah.
And that is it.
All right, so Senator Hardy, you had a question you wanted to ask?
Yeah, just a general, Jen, I'm sorry I missed your walkthrough the other day. So is this bill generally with, obviously I know there've been some changes, but generally of the same as the one we did 2 years ago? I think it was 2 years ago.
Yes.
Okay.
No, we took the cup out.
Yeah.
Right. Yes. The purchase, use, and possession piece is separate, in a separate bill, S19. But yes, as far as what this looked like for banning flavored tobacco products and e-liquids, yes.
Okay, great, thank you.
Okay, so that language, what we talked about yesterday, are you comfortable with the language as it's been presented?
Yeah. Let me know if there's anything you want me to put back up.
Any questions of Jen regarding that draft? No. Okay, we're good. Thanks.
All right, I'll take it.
I wish we could see you.
I know. I don't know.
Little
I don't
blanks.
know what's going on. Shadi's going to try to help me when I'm done here.
Okay. You're gonna find a piece of black tape over your camera.
I really don't think so, but it looks sort of opaque.
Okay, committee discussion on this bill, because I think we've been through it and it's probably gotten to the point where I would be open for a motion on the bill.
Before we get to the,
Sure.
to the vote part, I just feel compelled to say something. So I fully recognize that the current legislature and over the past 30, 40, 50 years is it's kind of, it's quite liberal, it's quite pro-choice, recognizing personal freedoms, personal choices, which I fully respect. But in this case, I believe, it's my perception that the legislature is kind of picking and choosing social liberties. I think that I feel that this bill is somewhat reminiscent of the Prohibition Act, in that we're really, it's more of a social cause and reflects poorly on personal social choices. I think that I know that tobacco purchases and usage is it's illegal for minors, and we focus very heavily on minors and the impact, and I get that. But unfortunately, this also impacts the choices of adults, and I just don't feel that's appropriate. And unfortunately, even though I recognize health implications, I'm not going to support that. I'm happy to address any of those concerns, but just felt they needed to at least put that on the table that I think it's I don't think it's a well thought through.
Okay. So it is about addiction, and where the information that we have heard, and we're not taking tobacco away from people. They can still smoke tobacco and gain addiction to nicotine. They can still vape if flavors are not without flavors. And we've heard a lot about the role that flavors play in inducing addiction, and that there's no measurement for the amount of nicotine in some of that liquid. So we're not taking away the personal choice to vape or to smoke. We are taking away flavors that are known to accelerate addiction and use, and then a continuation into adulthood. And we've seen the data coming out of Massachusetts where there has been a reduction in the use of both vapes and tobacco, and that there has not been an increase in cross-state sales. There was initially, but now it hasn't perpetuated in New Hampshire. So so I hear what you're saying, but right now, if you walk into any school, pretty much you're walking into an epidemic environment where kids are vaping flavors. and then becoming the next generation of addicted adults. So I would just respond to that. I don't see this at all as a social issue. I see this very much as a public health issue and trying to save us hundreds of millions of dollars a year in health costs, lost work, the whole thing that we have seen. Martine, you look like you're ready to speak.
I was just going to say where, the testimony really hit home for me was around protecting our children. And also the way that this very large, well-resourced corporation is manipulating their advertising to really attack, I'll use the word attack, people of color, folks from the BIPOC community, and again, children. They have resources that are even beyond my comprehension to throw at their advertising. And I do think we need to protect vulnerable folks from that kind of predatory marketing. So I'm going to support the bill.
I can say something for Ken.
Yeah, no,
I think this is just overreach. Until you take away the device, make them illegal, they're going to continue to vape. If you take away the flavored product that they want, they're going to go to New Hampshire or New York State and they're going to get it. I just don't think this is going to stop it. I think it may have an impact on it. And then when you throw it in, it's okay to do it for marijuana. Kids are smoking marijuana too, they're not supposed to. So I just think it's hypocrisy.
we don't have a strong regulatory system around what is in the state in terms of tobacco flavors, but we do for cannabis.
I mean, we went after the tobacco companies and we got a big settlement out of that. What about marijuana? You can't smoke tobacco, but you can smoke marijuana. Unfiltered, it's going to have more of an effect on your health. I just don't agree with it.
Senator Hardy.
I am supportive of the bill. I supported it 2 years ago. I thought that we had some compelling testimony. I hear you. I understand your concerns, and you're not alone. I think it's a tough kind of balance to make when we talk about any kind of vice. So broadly speaking, I don't necessarily like that word, but I think you know what I mean. And I am definitely sympathetic to the concerns you have, but I fall more on the agreeing with Senator Gulick and her concerns about how these products are being targeted at certain subsets of the population who are more vulnerable, and the public health concerns about the products more generally. And as a mom of teenagers, I see what happens in our schools. I've substituted in a middle school, and we had to close the bathrooms a bunch of times because kids were vaping in the bathrooms, and so which causes other problems. So I'm totally sympathetic to your concerns, but I just fall more on the wanting to support public health and health equity. So I yes.
Just one more thing for me is that, to your point about the problems it's causing in the schools, that's because there's no consequences. If we allow that to happen, I think we'd be better served to put things in place that would stop that type of behavior by empowering the administration of the schools to do something about it rather than to try and cut off the supply.
I think it's a frustrating situation. As we heard from the Principals Association, they're also, their backs are up against the wall, because it's really, these little things are small. I sat in Senator Hardy's chair one day when there was someone here talking about vapes at a vape shop. And all of a sudden I started feeling congested. And I looked over and this adult male was vaping and you couldn't even tell that he was doing it. So, I mean, it's not something you see. It's just difficult. I understand exactly what you're saying. I hear what you're saying. But sometimes, how do we turn the corner on such a significant public health issue? Do what we can do.
I feel in an odd place being more liberal than liberal party. That's just it's a weird position to be in.
I don't think it's liberal, I think it's libertarian, and there's a difference.
Yeah, there is a difference. Yeah. All right, well, I think we've all, I get the drift here and where we're going, and I think I would ask for a motion on the bill, the last draft, which is draft 1.1.
Yes. I will clean it up.
Yeah,
Make a clean copy.
so I would entertain a motion.
I'll make a motion to vote on this bill
And send it to the full Senate for consideration.
and send it to the full Senate for consideration.
All right, thank you, Senator. Okay, the motion's been made. Further discussion? Okay, then clerk, please call the roll.
Did we need to get a second on the motion?
No,
Okay,
we don't really. Sometimes it's fun to do it, but we don't.
okay. Senator Gulick, yes. Senator Hardy,
Yes.
Senator Williams,
No,
Senator Weeks,
No,
Senator Chair Lyons.
Yes,
Okay, the vote stands at 3-2-0.
3-2-0. Is that what you said? 3-2-0.
Yeah.
Oh, I missed it too.
3-2-0.
Good job, thank you.
And who's reporting?
Who would like to report this bill? I'm asking if you'd like to.
I can if you want me to. When will will it be, the week after break?
It will go on notice. It will probably be sent to finance. And then it would come up after finance considers it. They have an extra week with their bill. So it would be up for notice on the Tuesday that we get back. And then finance would take it that next day. Let me see, yeah. Finance would take it that day, and then they would have up to 10 days to evaluate the bill. So that's how it would go. Are you willing to report the bill?
So will it be ready by crossover?
Yeah,
Yes.
yeah, that's, it'll be on the notice calendar, the Tuesday, which I think is what day?
The 14th.
The 14th, the day after your birthday.
Okay,
Okay. the
Yes.
14th. Okay.
I'll report it.
Okay, good. What I might do is I might ask forgiveness and get it upstairs for you today, see if the secretary will accept it. I'll take it up on your behalf and see how it goes. Keep it posted. And then, good, thank you for that. All right. Robin, thank you, Jen. I think that your work on this bill has been really helpful.
Great. I just cleaned up and I'm sending a clean 1.1 to the chair, the reporter, and Alex.
Probably, yeah, but. All right. Great. Okay, is Robin Lunch coming on?
She should be coming in on Zoom. I'm trying to get on her now.
Okay. Oh, here she is.
Oh,
Terrific.
in person, perfect.
Are you ready for me? Yes, we are. Thank you for being here. We'll try to finish by 25 after, so folks have 5 minutes to exhale.
Perfect.
Thank you for being here.
Yes.
And we're here to consider your nomination to the Green Mountain Care Board for confirmation for the full Senate, through the full Senate. So we have your resume. And what would be helpful to us is for you to just talk a little bit about, very briefly, the challenges that you see in your work on the Green Mountain Care Board, and give us an understanding of what exactly you have contributed to the Green Mountain Care Board. And we're just short.
Great. So thank you all, Robin Lunge, for the record. So I've been on the board since November of 2016, and I would say that healthcare, as you all know, is it's always been a challenging topic in terms of balancing access, quality, and cost. The first thing that comes to mind in terms of my individual contribution as a board member is that I frequently have worked on projects with our staff. And there's a couple of them that I'm very proud of. The first is a regulatory integration project. So when I started at the board had inherited many of the key legislated cost containment efforts from a prior agency, and they came over siloed. So when I started with the board, to me, it made sense that we need to integrate these processes so that we can follow the money through the processes, which is easier said than done because different data sources and all sorts of technical stuff. So with Jessica Holmes, I worked with staff on a regulatory integration project, and I feel like there's two really good results from that. First of all, we can now follow the money, particularly between hospital budgets and rate review or insurance premiums. And secondly, I think that effort has created in our office a culture of continuous improvement. And I think that's really good because as staff and as board members, we have to constantly be thinking about how can we improve, how can we ensure the system improves, but also be inward looking to create improvement in our processes over time. The second that I would mention is the Rural Health Services Task Force. I was asked to chair that by former Green Mountain Care Board Chair Kevin Mullet. And that was a legislative task force with a number of diverse stakeholders that came together to really look at rural health issues in Vermont. And this was in 2019, so prior to the pandemic. I think that there have been several achievements from that effort. First of all, many of the workforce initiatives that the legislature has considered and passed since then started as part of that report that we came back to the legislature with. So it's helped, I think, inform the legislative conversation about important issues in healthcare. And it also was really, in some ways, the canary in the coal mine around some of the hospital sustainability issues that we're now tackling. And then just briefly, third, another effort that I am proud of is that I've really tried to mentor many of our junior staff into helping them become leaders in our organization. So that's been personally very rewarding for me, and I think an improvement for our organization as well.
Thank you. I failed to have us introduce ourselves to you, so we're going to do that now. Go ahead, Senator.
I know Senator already. Hi.
Senator Terry Williams from Rutland County.
Nice to meet you.
Morning, Dave Weeks, Rutland County.
Nice to meet you.
And behind you, Senator LaRock, you want to just say hello?
Senator Gulick. She's there.
Thanks.
She's there.
She's there. Okay, she's not feeling.
Oh, I'm sorry to hear that.
All right, so questions committee, someone has a question for Robin. So you've been on for a bit, you've had, the terms are 6 years. Your term now is for 1 year.
Yes.
Filling out a term for someone else. And what is your interest in going forward on the board?
I certainly would love to continue to contribute to the work of the board. As you can probably tell from my resume, I've been working for the state for about 20 years, I think now. Starting actually as legislative counsel, although I did a short stint in the judiciary right out of law school. You know, it's kind of in my blood being a state official and working for Vermonters. I'm from Vermont. I grew up in Brattleboro. And coming home to Vermont and really contributing to the state has been really my lifelong work. So, you know, if that doesn't turn out, then certainly I'll look for other ways that I can contribute.
Questions?
No questions. Pretty impressive, wasn't it?
Thank you.
We're
Solid
really,
as it gets.
Senator Murray.
I don't really have a question. I know Robin pretty well. She and I have worked together on a number of things in my 2 years on this committee. And I just want you all to know, she is incredibly diligent and intelligent and just passionate about her work. And so much of what the Green Mountain Care Board has been able to accomplish would not have happened without Robin. She is a crucial member. So I hope everyone supports her nomination.
Thank you. I appreciate that. It's a team effort.
And I've known you since you started here, and then
Yes,
you went
you have.
off and left us to the budget group and came back. Work like that.
She is the former Jen Kirby.
Yes, Jen started when I was on my leave of absence, when I went to DC for a short period of time, and then we worked closely together when I came back.
Yeah.
Yeah, Jen and Nolan and I were the team, and before that, Steve Capel, who
Oh, I
probably
forgot. Yep.
not everyone knows, but he and I and Maria Royal actually were the healthcare team for the legislature. So, you know, I think that having worked here really gives me a very broad background in all different areas of healthcare. And so it really, I see as a major asset to my work on the board because, you know, my fingerprints are buried in titles 818 and 33. So.
Well, you know, just speaking of statute, the bill that we passed last year, Act 167, and your support of our work in passing that legislation was pretty key. And beginning to look at global budgeting and hospital financial stability, but then also the second part of looking at the assessment of community health needs. And can you elaborate a little bit about your thinking on that? Because I know you have been taking a strong lead along with us on trying to move forward in that whole arena.
Yeah, absolutely. So, and I think Chair Foster mentioned when you talked with him on Wednesday that I am co-chairing the Global Budget Technical Advisory Group with Pat Jones, who's the interim director of healthcare reform from AHS. And that work is really, you know, we've had, I think, 2 meetings, and we are doing a deep dive into the methodologies for global budgeting that exist both in Pennsylvania, Maryland, where applicable, what had happened in Rochester, New York in the 80s, which are really the 3 live, you know, in real life examples, so that we can make sure that we're looking for lessons learned from other states and while understanding how it might work best for Vermont. So I'm excited about that work. I like the weeds. So I think it's going to be interesting to see what that group can come up with for recommendations in terms of how to implement global budgets and, you know, pros and cons and all that kind of stuff. And then I'm looking forward to moving forward with the community engagement. I don't think I will be a board member lead on that, but as a board member, I'll certainly get updates on the process. And those two, the way I think about those two is the global budget is could be a necessary payment change in order to facilitate transformation and work around how to sustain our healthcare system and while ensuring access for folks and high quality. But it's not sufficient. Changing the money alone, I think, in our history has not proven to be enough by itself. So engaging and understanding our healthcare system better through the data analysis anticipated in Act 167, as well as engaging with communities to understand the community needs, is an important next step, and I hope will be a good synthesis. And certainly, you know, it's been vital that we work together with AHS in partnership on those efforts.
So it sounds like there's a little bit of enthusiasm about keeping working on all this.
Sure, yes. I hate to see projects midstream, but and this is a long-term one in my mind.
Any other questions for?
Thank you.
Thank you.
Yeah, thanks for having me.
Voting very soon.
Wonderful. Well, have a good morning and
You as well.
oh, good luck with the floor.
Should be easier than yesterday.
Okay. Yeah, you have some weighty bills in here this morning.
Well, I just saw Eric Fitzpatrick and Devin Green pop up on the screen.
Ah.
That sounds like a rhyme. We can look at, S 36 briefly. Eric, you have some language for us? I think it's being printed out for us right now. Eric, are you there?
Yes, can you hear me?
Yes.
Alrighty.
I think let's just look at it and then we'll have to come back to this bill. We're not gonna vote on it now, but I think let's see what we have at this point. We still have another decision to make. You wanna put it up on your screen?
I can try pulling it up. Is it on the committee's website yet?
It is, yes.
Okay.
Okay, let me try that.
Yeah.
I think I may need to refresh probably.
I'm gonna give it one more minute and then we might have to look at it independently.
Oh, I think we have it.
Oh, good. Okay, here we go.
Yeah. So the new language, remember, had to do with the topic of the de-escalation report.
Okay.
And you'll see, so I'm scrolling down to where that is. You'll see here it is, it's section 4 is the report. So the proposal is to strike the existing language you had on the report. My understanding was that Mike and Devin were both able to work on this language, getting it to a point where they were able to agree. And they provided to me, and then I put it into this section to replace the existing report language you had. So again, you'll see that one difference is that it's got the program for quality in healthcare is the reporter in consultation with stakeholders. So that program is the one that does the reporting in consultation with stakeholders. And what does the report consist of? It's you'll see it's regarding this is line 20, regarding de-escalation of potentially violent situations in healthcare facilities. So the general topic is the same. And says with a health equity impact informed lens, report shall include best practices for de-escalation, types of de-escalation practices currently in use. So that's kind of some of your data approach, barriers to training and recommendations for appropriate policy improvements. So that's the approach. I think I've got it all on the screen there so that you can see the whole paragraph together. But that's my understanding of the language that was agreed to.
Okay. Thank you. Mike Fisher is in the room and Devin, you're on the screen. Committee, any questions about this? This is new language for us, but it replaces what, puts in place what we had talked about earlier. Any questions? Good. Okay. Okay, this is good. Here's my suggestion. We still have to go back and look at disorderly conduct one more time. I'm going to suggest that we have this proposal to look at over the next week, and as you're making your minds up, let us know. I'm going to have Alex reach out to the VPQHC, the Vermont Program for Quality Health and Healthcare, and just to confirm their participation. That's it. Good. Thank you, Eric. Thank you for working overtime this morning. We greatly appreciate it. And also to Devin and Mike Fisher, thank you so much.
Thank you.
Sure, happy to help, and everybody have a good week.
Okay, good. All right, we're gonna go off live and that will wrap it until Tuesday, the 14th.
Oh, so we're gonna vote on this after?
Well, unless you want to vote on it today. I mean, we could come back.
It's fine.
we're
We're
off
not in a
live.
rush. We
We're
can